have this in our playlist on YouTube. And with that, I'll turn it over to Allison Kuntz, who is, I think, on this call, who will introduce our speakers. There she is.
Thank you so much. And as always, we definitely want to thank the library for this amazing partnership. We always have a ton of fun being able to bring a variety of health topics to you. And so just thank you to the library and thank you all for being here and being such an engaged audience. I did want to just give you one little bit of information about an upcoming fitness and wellness challenge that we're having. It's called Drive Away the Winter Doldrums, which on a day like today seems very fitting. And that is actually going to start in February, and it runs February 16th through March 29th. And it's kind of pick your own activities, learning about stress management, some fitness things, nutrition, a little bit of mental health. So just kind of looking again at overall health and wellness. So that is a free program, and the information about that is on our website, lmh.org. And with that, I'm going to turn it over to our two amazing presenters and let them get started. So thank you so much.
Oh, let's try that again. Can everybody hear me okay?
Yes.
Perfect. Okay. Good afternoon. Thank you for having Ashley and myself. My name is Tanya Eckhart. I'm one of the nurse practitioners with LMH Cardiology Services, and I'm joined by my coworker and colleague, Ashley Lauer. We're both bachelor or master's prepared nurse practitioners and board certified. So today we want to talk about something we offer at Cardiovascular Services. It's called a Take Heart assessment. This is an appointment with a nurse practitioner. So, hold on a second. Technical difficulties here. Sorry. Sorry, guys. Give me just a second. Okay, let's start this over. Okay, first we want to talk about some basics. So going back to that first slide, we want to talk about heart disease. Oh my gosh. Okay, so coronary heart disease is a leading cause of death around the world. So the goal with these visits is we want to take a preventative and lifestyle modification approach so that we can help reduce the risk of morbidity and mortality from coronary artery disease. So basically a basic definition of coronary artery disease is when plaque builds up in the heart over time. This can happen from multiple things, diet, poor diet, low exercise, high cholesterol, lifestyle things such as having a high blood sugar, and also sometimes just your genetics. Sometimes you can't help it. Plaque buildup in the heart can lead to basically not getting enough blood flow through, which is what carries the oxygen to our heart. And this is called ischemia. So high cholesterol, this happens from having a lot of bad cholesterol known as LDL. That can increase the risk of cardiovascular disease. LDL over time combines with other substances inside the body, and it slowly builds up, and over time will form these really thick, hard deposits on the inside of your arteries, which can basically cause that ischemia over time or not letting the blood flow get through. This is a modifiable risk factor, so we can control this risk factor with lifestyle modifications like a heart healthy diet, And also medications like your statin therapies are probably what most people are familiar with. Another risk factor is having high blood pressure. So the American Heart Association defines a normal blood pressure as being less than 120/80. Sometimes blood pressure is called the silent killer because there's often no symptoms associated with this, but over time, you will have end organ damage, like with your kidneys, your liver, your heart, and it can increase the risk of heart attack and stroke. So some ways to reduce your blood pressure without medication, because that's always the goal, is to have as few medications on board as possible. So you want to have a good diet, keeping the sodium in your diet particularly low. The average American gets 3,000 to 4,000 milligrams of sodium in our diet a day. And we really preach having it under 2,000 milligrams a day. So we do a lot of talking about watching your labels. We want people to kind of limit their alcohol intake, having regular physical activity, managing stress as much as possible. Don't smoke, so quit smoking or don't pick up smoking. Maintain or reach a healthy weight. If you're concerned about high blood pressure, please don't put this off. Please talk with your medical provider right away. So what is a take heart assessment? Because that's what we're talking about today. So we actually have two types of take hearts. We have a 30-minute and a 60-minute. These visits are with a nurse practitioner, not an MD who specializes in cardiovascular health. So we'll review your heart health risk during this time. I want to point out that these visits are not covered by insurance. They do have an out-of-pocket cost that is to be paid at the time of visit. When you schedule your assessment, one of our nurses will schedule to have some blood work drawn. That'll be done prior to your appointment so that we can review this with you during your appointment time. If your primary provider has not already ordered these labs, if they've already ordered them, sometimes we can just go ahead and use those if they were done recently. As I said previously, you will not meet with a cardiologist, so it should not be considered a cardiovascular consult. If you're having symptoms and you're concerned and you want to talk with a cardiologist, you will still need to have a formal referral from another provider. So the first one I'm going to talk about is a 30-minute visit. So the out-of-pocket cost associated with this is $40. What will happen during this time? Your blood pressure will be taken. We will measure your waist circumference. With that, we'll assess your BMI. We'll provide you with lots of education, heart healthy education materials, and what our exercise recommendations are. Prior to your appointment, you'll have fasting blood work drawn if it, like I said, not recently done by your previous doctor. What we look at with this is a fasting lipid profile, talking about looking at that LDL, which is what causes that coronary calcium to build up over time. We also want to look at your thyroid levels. Thyroid levels can not only affect your metabolism, but can actually have effects on your heart over time. We also want to look at a fasting blood glucose. People with high fasting blood glucose can actually have a higher risk of cardiovascular disease, and part of that is the inflammation that comes along with having a high blood glucose over time. It can kind of help with that plaque buildup. And then the next one is our 60-minute take heart visit. So the out-of-pocket cost associated with this is $75. It's a little more pricey, but you get a little bit more time. So you have a full hour, including the time it takes us to go over all of your labs and everything. What'll happen during this appointment is we also take your blood pressure. We'll again measure your waist circumference. We'll check your BMI. We'll provide you with the same educational materials that we provide in the 30-minute visit. It's a big packet. We'll discuss our exercise regimen, our recommendations. You'll still have blood work drawn prior to your appointment. We check that fasting lipid profile again because we want to look at that LDL specifically. We'll check your thyroid again. And then we also, in addition to your fasting blood glucose, we actually want to look at hemoglobin A1C in addition. So an hemoglobin A1C is actually a measurement of your blood sugars over the last 3 months and not just that fasting blood glucose. So that is that, and I'll take questions and then I'll turn it over to Ashley.
Let's see. Can you see those or I can read them to you?
Can you read them? Because I keep hitting the PowerPoint when I
Sure,
try to.
sure. Mary's asking, aren't blood pressure okay if they're higher for seniors?
Correct. Yep. We do allow a little bit of a higher blood pressure in seniors. So it's not a one size fits all. It's definitely a kind of a tailored to you
Mhm.
specifically. So yes, that's a good question.
And then Shelley's asking, is the blood work a separate cost or part of the fee, the 40 or
Question. It's
$75?
a part of that cost. So great question.
Oh, okay, great. And is this tailored to a certain age group or is it available to anyone, to
It's
any
available
adult?
to anyone. You know, we don't typically see like young people in their 20s coming out to
Right.
see us, but yeah, it's available to anyone.
Okay, great. Anyone else have questions for Tanya? And is this is done at the hospital or I mean, where's the,
Yep,
what's the
it's done in our
location?
clinic at CSL, and we'll get into more of that at the end of our presentation where we're located.
Oh, okay. Yeah, what does CSL stand for?
Cardiovascular Services of Lawrence.
Ah, gotcha. Okay.
Give me just a second. I think I accidentally closed out my slides.
Oh, no. Yeah, it says it timed out. Back in action. Go.
All right, let me get Ashley to where she needs to be here.
Okay. Yeah, that's nice. It's bigger.
Oh,
Always
sorry
easier
about
to-
that.
No, 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 it's great.
Thought we had the bugs worked out, didn't we?
We thought so.
Yeah, well, it's always an adventure, I'm telling you.
All right, Ashley, take it away.
Okay, so more on these take hearts. We calculate your heart health risk assessment. Basically, we use all the information that we gather in these visits to calculate your 10-year cardiovascular risk. If we have any recommendations going forward regarding your score, we will send the recommendations to your primary care provider. If any of those, recommendations lead to further testing, like a cardiac calcium score, which we could talk about a little bit if you want to, that may, if that's elevated, that may, get you right back to see us for further evaluation with the cardiologist. So it's good to do these. A lot of people find benefit from these. So in general, we recommend the following to reduce your cardiovascular risk. Maintain your blood pressure within reason to goal, 120/80, or at least below 140/80, depending on your individual goal. If you're using a home cuff to assess your blood pressure, we prefer an upper arm cuff for accuracy and to have those cuffs evaluated or calibrated at your primary care's office once a year. Just bring them in and during your annual to see how accurate they are versus our manual cuffs. Total cholesterol should be less than 200 with special attention to that LDL. BMI less than 25, and do not smoke or use tobacco products or any vaping as well. Make sure you get in at least 30 minutes of exercise a day. That is recommendations from the American Heart Association. And eat a good diet high in fruits, vegetables, whole grains, high fiber foods, and limit your saturated fats, cholesterol, alcohol, sodium, sugar, and trans fats. The education materials Tanya was talking about, the big packet we give you, it's actually a folder that you can take with you. Information regarding heart attacks, signs and symptoms, strokes, signs and symptoms, and what those risk factors are for those two. Maintaining lifelong heart health with diet and exercise and those recommendations. Ways to reduce your blood pressure without medications like lifestyle modifications such as weight or losing weight, and low sodium diet, and ways to improve cholesterol with dietary modification, like Mediterranean diet, such as fruits, veggies, fish, lean meats. Life's Essential Eights, as recommended by the American Heart Association. Eat better, manage weight, be more active, good cholesterol control, quit tobacco, manage your blood sugar. This usually is done yearly through your primary care provider with a hemoglobin A1C measurement. Get healthy sleep, 7 to 9 hours at night for adults. I will add here that if you do have sleep apnea, if you've ever been diagnosed with sleep apnea, it is recommended you be treated for that if a CPAP is recommended for you, as this can improve your heart health as well and manage your blood pressure. Here is the calcium heart scan I was alluding to earlier. So it is a CT of your heart, and basically that measures a total score, and it looks at the calcium buildup around the heart in the arteries, and gives us that score through the listing at the bottom of the screen there. It's a screening test that a lot of our primary care providers are using now more often. It's not covered by insurance, so that's about $60 out of pocket. And most patients find benefit from this. Even if they get a perfect score, which is 0, they find that it's a little bit more reassuring that they're at a lower risk for a heart attack or complications thereof. So what does the results mean? So if you get a 0, that means that's okay. I'll go back on mine. If you get a 0, it's the lowest risk. If you're in the moderate risk or above 1, we usually look at, you do have some calcium there to whatever degree. And if there's recommendations for any medications such as atorvastatin or a statin medication to lower your cholesterol, or a baby aspirin, it's just more of a preventative to try to help to slow that down. High, good question. I'll answer that right now. High coronary calcium, 300 or more, and it'll kind of break it down to which arteries those numeric values are in for us. That can lead to, depending on if you're having symptoms, we could do a stress test at that point to see if you're having any issues with narrowing that is causing lack of blood flow around your heart when you're exercising or your heart is stressed. Going a little bit further, if that's really high and you are having symptoms, they may just go straight for a cardiac catheterization to actually look at those coronary arteries and see how much narrowing you have there. So why do a take heart exam? It's an in-depth review of your overall cardiovascular risk. We provide you with education and resource to reduce your cardiovascular risk overall. Make recommendations to your primary care provider based on our assessment regarding further workup or medications that may reduce your cardiovascular risk. And if you have any further concerns regarding symptoms pertaining to heart health, at that point, we would recommend your PCP doing a formal cardiovascular consult. This is where our clinic is. We're kind of stuck in between the main entrance and the ER entrance with what street is that, Tanya?
4th Street Health Plaza.
What's that?
4th Street Health Plaza.
4th Street. All right, we're on the 4th Street side.
Mm-hmm.
Oh, it's right there in front of me, yes. So our entrance is on the 4th Street side. So a few opportunities to stay active around, and some of you may know about this, the Sports Pavilion in Lawrence, which is out west on known as Rock Chalk Park. They have lifelong recreation classes for 50+ years old, and you don't have to be 50+. But there is a cost associated per class when I was looking at that. But they have some classes tailored towards 50 plus, and some of them look really fun. They also have free services or activity for Douglas County residents, which include the little gym there, as well as the half-mile indoor walking track. If you're a Douglas County resident and you show proof of your address, you can get a little key fob that you just scan in when you go in. And they also have like treadmills there and step machines and little weights and things like that. Silver Sneakers, this is through select Medicare plans. And I put a website there where you can go on and check your eligibility through Medicare if your plan pays for that. And some participating gyms in Lawrence include Genesis Health Clubs, Crunch Fitness, and Planet Fitness. So that's something you can look into. And that is the end of the presentation, and I can answer some of these questions, and please add more questions because this is the point where we will take those and we'll go through those.
Yes, so there's a question about once somebody's been diagnosed with high calcium, can it be reduced? Like, what do you do to reduce it?
It cannot be reduced, unfortunately. That's kind of the score you get, and ultimately it does go up per year. What we do at that point is we do preventative measures, and we get good control of your LDL, your bad cholesterol, by usually putting you on a statin or a lipid reducing medication with the goal of being less than 70, that LDL, per the American Heart Association recommendations, and then a baby aspirin just to try to reduce that further progression to some degree. Oh, 8th
Um,
thank you for correcting me. Sorry.
Yeah. It's like, wow, that's a half mile. That's a big track inside that building. So could you walk us through kind of what the process is for doing the calcium heart scan? I mean, what's entailed? Do you get hooked up to a monitor, or like, what do you guys do?
I've actually had one, Ashley, if you want me to speak on it.
Yeah, can everybody hear okay? It's kind of muffled. Are you getting that too?
I can hear.
Okay.
Yeah.
So I've actually had a CT coronary calcium score myself. It's really pretty simple. It's about a 5-minute. I did mine out at LMH West. I know the main campus does them as well. You get a few heart monitors on. You go through the CT scanner. It's about 5 minutes. You don't get an IV. There's no contrast involved. And I had my results before my provider had them. So I actually had them within about half an hour. And it was really simple. Everybody was great. And luckily my score was 0.
That's great. I'm going to mute myself here. And Shelley, did you have a question regarding this slide?
Is this the slide you wanted to see? Can you see it okay?
Yeah, I can see it well.
Perfect.
Yes, that's the slide I didn't finish reading.
And then you kind of alluded to like accuracy of like blood pressure, like a cuff versus a wrist. I know like when I go to the dentist, they use a wrist one, and actually like my primary care physician, like, you know, they hook you up to a machine, and she said, oh man, those are always so high. And she pulls out a manual one. So can you talk about what's the most accurate in terms of blood pressure? What type of device? Because they do all seem to differ in terms of results.
Do you want to take that one, Ashley, or do you want me to take it?
The upper arm is really the gold standard. So right below your shoulder, where the ones we use, our cardiologists like to recommend, I think, the Omron, OMRON brand, but really any upper arm cuff is more accurate than the wrist. The wrist is further away from your heart. It could be a little bit skewed as far as, you know, how you're holding it. They say to hold it near your heart. Well, you know, sometimes it's just not as accurate. But if you do have one and you know, they're kind of costly, you know, it's better than nothing. So I would still recommend bringing that into your primary care providers just to calibrate. And basically what calibration means is we take your blood pressure with the most accurate, which is the manual blood pressure cuff, and then take it with your cuff and see kind of how much that differs. And then we kind of adjust it from there. I would recommend putting fresh batteries in it before you go in. And then we do recommend doing that at least once a year, is having that checked. Or if there's any discrepancy or concern, for sure, but.
There's another question. Is it possible to have a 0 calcium score if you are overweight, don't exercise like you should, and have high blood pressure? It doesn't seem like that would be accurate.
I've seen it. I don't know about
Yeah.
you, Ashley, but I have seen people with a 0 calcium score that are not living the best, healthiest lives, but then at that point we need to talk about, like, what do we do to try to prevent calcium from building up and try to do everything we can to keep that score at 0. Could just be luck. You could have good genetics and, heart disease doesn't run in your family, or you could actually have a pretty good cholesterol level.
Seen the opposite too, where people are, really active, they eat the right things, they exercise, and they have coronary calcium. Guess what? That's probably genetics at that point playing a factor. So, it's not all straightforward. And, going back to that question, there's a portion of it I didn't answer. As far as we trying to reduce the risk if you do have coronary calcium, same thing as heart health, exercise, diet, and things like that. So.
So Shelley's asking, why does calcium build up in our circulatory systems?
Plaque, cholesterol.
So it's due to all those factors.
Diet, exercise, smoking is a big one. Please don't smoke.
Yeah. So
Having your blood pressure nice and low.
So, and how often do you recommend that people take this test? I mean, is there is it every other year? Or, I mean, you've got all these different screenings. And how about this one?
the coronary calcium testing.
Yeah.
Generally, really, you don't really need to do it more than, every 5 years, I'd say,
Okay.
or 5 to 7 years. It really kind of depends on what's going on. That's the least invasive kind of screening test that we have. We know it's going to go up to, a certain incremental. But, if we're concerned that, oh, maybe you had 100 on this one 5 years ago, and now you're actually having some symptoms, they may just go ahead and do a stress test at that point, not necessarily repeat the CT coronary calcium. So it's a good starting point, but I have seen it repeated, but generally not any sooner than every 5 to 7 years. And is that, Tanya, what you have seen? Okay.
Agreed.
It sounds like it's kind of a slow-ish build. So, and Dee's asking, if you take your own blood pressure at home, it varies throughout the day. Can you speak to that?
Go ahead, Tanya, if you want to.
Okay, so I do recommend that we don't overcheck our blood pressure. It can kind of lead to some anxiety, and then we're just kind of hyper focusing on it. So in general, if you take a blood pressure medication, how we recommend that you take your blood pressure is just once a day, at least an hour after medicine. You do need to be sitting down with both feet flat on the floor for a full 5 minutes at least. It is totally normal for our blood pressure to go up when we're up moving around. That's what our body is supposed to do. And so some of that varying throughout the day could have been you were active, you sat back down, maybe you had a salty lunch, and then your blood pressure went up a little bit. So I generally don't recommend that people hyperfixate on it. Just once a day is totally fine. If you're not on any blood pressure medication, just once in the morning after you've gone to the bathroom and you've been sitting down with both feet flat on the floor for the good 5 minutes.
So is, in terms of, susceptibility, is there a difference between like heart disease in men versus women in terms of, do more women get it? Do more men get it? Is it an age thing? You talk about that.
So I've seen 30-year-olds with heart disease. I've seen 30-year-old men with heart disease. I've seen 30-year-old women with heart disease. It is, I think, more prevalently, it kills more women than men because our symptoms can present a little differently than men's symptoms. But, overall, there's some new data out on that too. Like women are not quitting smoking earlier as their male counterparts. So there's a lot of factors that go into that. I wouldn't say it's as black as white as it happens more in men versus women. I think it can affect everybody equally.
Anybody else have additional questions for our speakers? Yeah, I'm trying to think of additional things that we might be interested in talking about as far as other services that you all offer at your clinic, that sort of thing. Oops. Oh, there's another one that says, do you have any thoughts on how green tea plays into good heart health?
No.
Any studies or anything like that?
Yeah.
I just come by any recently, so no, not really.
It's actually higher in caffeine than a cup of coffee though. So, you know,
Interesting.
in general, coffee is a diuretic. It makes us pee out more of our water. And so it can cause some lightheadedness when you're standing and things like that. So with all caffeine, we recommend no more than a couple servings a day.
So it's really the caffeine as opposed to the, I guess,
Yeah, I don't have the studies on
medicinal
the green tea
quality.
in particular,
Yeah.
but that's a good question. I'll have to look that one up.
Yeah, because I mean, obviously caffeine can affect your blood pressure and things like that. Okay. All right. Any other questions out there? I think this has been really interesting.
I do have one thing to add. You know, you can still talk to your primary care provider if you feel like you have some risk factors, especially, you know, any family history of cardiovascular disease, or coronary artery disease. They can order a calcium score, a CT calcium for you. I know I mentioned it earlier, but I just want to make sure that you don't have to go through our heart healthy, just to get the coronary calcium score. They can sure order that for you.
Let's see, looks like we have another one down here.
I don't recommend taking your blood pressure every day. You know, and it, like Tanya said, it can lead to anxiety and kind of, unless you're having symptoms of, you know, lightheadedness, dizziness, or headache, like your blood pressure is too high, or you're having your primary care provider is having you monitor your blood pressure because it may be increasing or decreasing, or changing your medications around. I don't. You can periodically check it, but I don't recommend checking it every day.
So what's the difference between like inflammation versus calcium levels? I mean, I know that, are they interconnected? Are they different? Are they the same?
They're
Seems like
connected.
they're closely linked.
Yeah,
but
that's like the same with smoking. That raises your
Mhm.
inflammation in your body. Having a high blood sugar raises your inflammation. So they kind of go hand in hand. Patients with diabetes are going to be at higher risk for coronary artery disease or having that plaque build up in your heart.
Mhm. Okay. All right, anybody else have anything? Let's see. And I mean, and obviously the calcium in your heart is not linked to like a calcium supplement or anything like that, right? I mean, yeah, it's a different thing.
Good question.
know
Though. We
this-
get that question a lot, actually.
Yeah, it's like, am I taking too much calcium or
Yeah.
drinking too much milk or something like that? And it does appear to be a totally different animal.
Well, I think that the cholesterol, you know, is just not, it's not saying, oh, I'm going to go to the heart today. It doesn't matter which artery, it will decide to stick on any of them. So in your coronary arteries here in your neck, it can stick here. It can stick in really anywhere, even in your legs. So, you know, if you're having any, pain in the back of your legs and your calves, like when you walk a long distance and it's kind of aching when you walk, that can mean that you may not be getting enough blood flow down to your legs. So that calcium does not, or plaque does not just pick the heart. It can settle in any artery in the body. So we also kind of look at that as in cardiology, and screening for those two.
Yeah, it's always hard to kind of know when to be concerned and when not to, but Yeah, so Shelley's asking, is calcium buildup the same as hardening of the arteries? I know that was a term my dad and my grandfather always used. It's kind of,
I think, yes, it's similar. It's normal as we get older, for our arteries and veins to get kind of stiffer. The walls aren't as elastic, in our veins and arteries. So it's similar, probably a similar term that was probably used interchangeably, previously, but, we've kind of differentiated that term now.
and are there certain forms of exercise that are better than others? I mean, presumably cardio exercises are better, but I mean, if things like weight training or anything like that, I mean, what do you recommend?
Cardio is obviously preferred. That's what we prefer.
Mhm.
So that's that 150 minutes a week, or 75 minutes if you're doing vigorous exercise. I always usually do recommend a little weight bearing exercise, especially for my female patients, because it helps with that loss of bone density that happens naturally as we get older. So I do recommend both.
Even with resistant fans,
Mhm.
or water aerobics too.
Yeah.
Those are really good.
Yeah, that's always a kind of a great option. I know the pool at Free State is really rocking and rolling first thing in the morning with the water aerobics groups. Because it's a lot easier on your joints and stuff, but great cardio for sure. So, well, is there anything else that we need to know before we let you go?
I can't think of anything, you, Ashley?
All right. And in order to schedule this, do we get a hold of you directly, or do you work through your primary care physician?
You can call our office directly and our front desk staff will be happy to schedule you.
Okay, great.
You want back to our phone number and
Yeah.
see what-
Yeah, that would be helpful to that last slide. Let's see. There you go. All right. So make note of the number if that's something you're interested in. And with that, I think can let you guys go unless there's any last minute questions. But thank you both so much. We really appreciate it. This is a great service to know about. And
Thanks for having us.
it's like anything, it's always better to always better to kind of, stay ahead of the curve. And this kind of test allows you to do that rather than wait too long, which I know a lot of us are guilty of. So,
Yeah, we've found definitely some things before it's happened. So
mhm.
these have been really good. The CT has been really good in catching those heart attacks instead of being proactive instead of with the reactive and
Yeah.
safe. So
It's great. Well, our next Gray Anatomy is coming up on February 18th. And the topic is urology, because I think is it like National Urology Month? There's some connection there. But hopefully just mark your calendar, look for that coming through on the February newsletter and register. And I know Cindy Carter had asked whether the Zoom links are consistent from month to month. They are not right now, and I think it's because our dates kind of jump around. But if we can make them that way, we will give it a shot. But we're working with a lot of different people's schedules, so look for the link and be sure to register. And thank you all for coming. So appreciate your being here with us.
Thank you.
Yeah, thank you.
Thank you.